Project L.E.A.P has been hailed as one of the most comprehensive advocacy training programs in the nation for people living with HIV. L.E.A.P stands for Learning, Empowerment, Advocacy, and Participation. Inspired by Houston's successful launch of the Project L.E.A.P, the Southeastern Michigan HIV/AIDS Council is excited to bring Project L.E.A.P to the Metro Detroit area. This program covers all aspects of advocacy. Some of the objectives are to give participants a better understanding how agencies are funded, how government decisions affect those living with HIV. We spoke with program organizers to ask what they found appealing about the L.E.A.P program and the function it will serve here in Detroit. And I learned about the program from our council chair, Quentin. He was informed that Houston had a Project L.E.A.P program, and the training was specific for planning council enrichment and empowerment and knowledge. So when he talked to me about it, I was excited, and as a result, he and I went to Houston to actually see the training for ourselves. And we came back with so much information and so excited to bring the program to our Detroit EMA. So I was so excited about that, just knowing that we can empower our own community, empower not only our current council members, but also individuals of the community who want to be decision makers when it comes to their health, and not only their health, but the community's health as well. So again, I was very excited about bringing Project L.E.A.P to our Detroit EMA. But along with that excitement, I must admit there was some fear to know that our training program was going to be 6 weeks long, and to have each and every person committed to that 6 weeks. I was a bit scared. I didn't think that we would have a lot of interest, but lo and behold, we started the program with 19 individuals, and we're ending the program with 19 individuals who are going to graduate. So saying that just to say that I'm excited about Project L.E.A.P, and I just believe that it will truly go far in our EMA. Response to this first-time program here in Detroit has been good because it attracts a unique variety of individuals from the HIV community. L.E.A.P participants include employees of social services organizations, planning council members, as well as people living with HIV. We asked participants why they enrolled in this program and what do they hope to take from it.
We did data collection through the state, and I really enjoyed that. I really enjoyed the parts where we did data collection and where we saw how surveillance works throughout the state of Michigan, and we even saw how it worked on a micro level.
Okay. What impressed me the most about the L.E.A.P program this year was that we got to dig really deep into what Ryan White was, who Ryan White was as an individual, and what Ryan White means now, today, the funding process, the allocations, and things like that. We learned a lot. At least I did. I absorbed a lot about how funding is given through federal grants or federal money itself, and then given to different programs for different things. And it actually really got to me the most that certain areas in which I know through my own personal experience and the work that I do really need a lot more funding than what is actually given to them.
The information that was given to us from funding through Ryan White Part A and the different departments, A, B, C, D, learning about data, the information, how to apply that data to whatever services that's out there that could be needed. It was a lot of information that was being presented, and I think that information can be helpful in, regardless what area of work that you want to work in.
Members of our planning body, they make decisions, and the decisions they make affect the people living with HIV in our community within our Ryan White program. And so having the knowledge to be able to come into a planning council such as this one and being able to already have the information needed to come in and make those decisions when it comes to finances, when it comes to planning out the ideal care plan, to have that knowledge, come in with that knowledge and be ready to, hit the ground running. I think it's a beautiful thing and very impactful because it not only helps, again, those who are in our council, but those who are in our council are giving back by helping those out in the community. So I believe that the LEAP program, the training that the graduates have gained, the knowledge and the empowerment will speak volumes in our Detroit EMA.
The information was quite fundamental with a lot of directive, that information that I didn't know, and I think for future gain it'd be important. I think Project L.E.A.P would be something that people can use to advance their career or just to get a stepping stone into whatever particular field they choose to get into.
My goal is to be able to help other trans men with education, prevention, and things of that nature. So as the work that I do now is to try to inform trans men, other trans men, that this is a thing that can happen to them, and to be able to help put programs together so that way trans men can not wouldn't have to be exposed to this, for one, and if they are exposed to the virus itself, then they will be able to have somewhere that they can go to and know that they'll be treated with respect and they'll get the things that they need.
It'll help me be a better committee member and understand what's happening and what's going on in the committee and the things that we're voting on for Ryan White and the things that need to be taken a look at. It'll help me also just to become, in general, a better committee member and to go on to a national level.
Project L.E.A.P organizers are paying close attention to participant surveys, how they can improve and enhance the curriculum. They are also thinking about expanding this program in 2019 to include more aspects of HIV healthcare, such as prevention, PrEP and PEP, medical breakthrough, U equals U. How quality healthcare is provided, deciding which services to provide to people living with HIV, and more. Introducing additional aspects of HIV healthcare may help clients to get a clearer picture and a better understanding of HIV health and how to be a part of the decision-making process. The organizers are happy to say that several of this year's Project L.E.A.P graduates will help create the curriculum for next year's training. If you would like more information about the Project L.E.A.P program in 2019, check out SEMHAC's website at www.semhac.org.